So my name is Art Levine. I'm with in Newport Coast, California. And shall I go back? I guess I should say how it got to this point. Okay, so 2009, my leg is basically, this leg over here feels like it's already starting to feel like it's not right. So I give it a year, and the first thing I do is I go and I find this guy that wanted to do some sort of electrical pads, and I put these electrical pads on my leg, and I did some exercises, and I did all that, and it wasn't, it was okay, but I had to do it over Skype, and I wasn't really with a professional, and it kind of bothered me a whole lot doing that, so I really wanted to go to a professional. So then I went to, can I mention the doctor? Okay, I went to Dr. Yaru, and he basically gave me a total knee replacement in the year 2011. I did the total knee replacement. I did all the exercises, very fastidious about the exercises, and I joined a club and I did all the exercises, and I was with medical arts. And after the knee replacement, they really could never get the knee to bend the full 180 that they would like it to bend. It could only bend like maybe 91, 92, 93. It never really could bend. So then they took me back, put me under the ether again, and then they made me, they bent it back, and the doctor said to me, look, mechanically it should work. There's something inside you that it's not bending all the way. And I'm going, okay, so I got on my bicycle and I did my exercises on the bicycle, I did my swimming, and all of a sudden, you know, I got it to bend a little more, but the problem is it's still not as flexible as it was before I got the total knee replacement. Now, when I climb upstairs, yes, I have little or no pain in the total knee replacement, but I got used to having the level of pain it was, and I sort of, you know, just got used to it. All right. So then this leg, just within the last year, just started making the same twingy stuff that this one started in 2009. So this time I said to myself, this is crazy. I have to find a better way than going through the rehab, going through the medical arts, going through all this, just to end up with things. And the real corker was, my father-in-law had 2 knees replaced, and he got an infection in his knee, and they actually, not his knee, in his leg, and then they had to open him up, take his knee out, put a rod into it, and for 6 months he was on the back. Now this is because he got an infection in the leg that he had the knee in. Believe it or not, they take the thing out, and they put a rod in. 6 months now, he's with a straight leg, sitting flat on his back, waiting for the infection to go down. Because when you have one of these things in there, the blood can't get around, so they take it out. And they don't kind of tell you this stuff when you get a knee replacement. They're not exactly come forward and say, well, if you ever get an infection in your foot or leg, we're going to have to take that thing out, set it aside, wash out the area, sew you back up, put a bar in there, and wait for 6 months until we can put it back in again. This, they don't tell you, you know. So anyways, when this thing came down and this was starting to bother me, I said I had to get a better way. And I spoke to a couple of my friends, and I had this one friend who told me, you know, my friend of mine uses a cold laser, and she's at a health club, and whenever she bruises, she put a cold laser, and we even used at a veterinarian a smaller cold laser, and it kind of fixed the dog's leg. And I go, wow, I gotta look into this. So one day I was looking at the register, and here's this full-page ad about this guy in Newport Beach, very close to me, that has a institute, and it looks legit. He's worked with NASA, he's got all these things. I go to YouTube. All these people are local. I guess if I wanted to hunt them down, I could find them. You know, these people look real. They don't look like actors. So I gave it a try, and my first treatment, bang, all of a sudden, no pain. By my 6th treatment, this thing feels like a 30, 40-year-old knee, you know? So And now, and then the real corker was by my third treatment, I ride a bicycle, see? And when I started riding a bicycle with this leg, when it had done, all I could do was ride with my heels. Then, after a lot more bicycling and a lot of things, I got to ride with my instep. I never could ride with the balls of my feet because I never could bend the knee enough, no matter how I adjusted the seat, to ride with the balls of my feet. And I knew that the best riding, obviously, is with your balls of your feet. So after maybe two of the applications with the Dr. Yo's thing here, all of a sudden, bang, I'm riding on the balls of my feet. Unbelievable. So that's my testimony.